So this is your girl Jasmine Yvonne, and this is going to be a video on how I study for med-surg. If you guys follow me on Instagram, then you guys know I took a poll. I took a poll on Instagram and asked you guys if you guys wanted me to do a video on how I study on YouTube, or just do like a live, or both. And you guys said a video, which I figured because in a video I can get way more detail. You guys can come back and watch it whenever. So this is why I'm here. So this is going to just talk about how I have been studying for med-surg and how this way of studying has helped me and has been working for me. And just so you guys know, I'm not just talking out my neck. I will tell you guys the grades that I got for med-surg, my 2 med-surg tests. Alright, so let me get right into it. So the first tip, definitely, of course, you guys know, I'm going to say just make sure you guys pray a lot before test, after test, during test. I mean, whenever you feel like you need a good prayer session. Praying for me does help me to stay calm with tests, help lower my anxiety. Because I think sometimes with doing bad on tests in nursing school, a big part of it isn't because you don't know the content. Sometimes it's just nerves. I know for me, sometimes when I'm really nervous, I say the wrong thing. I think the wrong thing. I overthink stuff because I'm just so anxious and nervous. Versus if I'm in my normal, chill, calm mindset, I'll know things like this. But when you're nervous, sometimes your thoughts just get mumbled up. So it's good to kind of calm yourself down before a test, because you probably will see a great improvement. Also, there's times that, you know, because we have to go into our testing sites where it's like a lab, because the NCLEX is on the computer. So most nursing schools, they test on the computer to kind of get you prepared. So we're in a testing lab, and it's a lot of people in there. A lot of people are talking. A lot of people are still trying to do quick review. And I usually have to kind of step out of the class and just go sit somewhere by myself, go into the bathroom and by myself, or go back to the classroom where nobody's really in there, and just kind of chill and relax and just kind of get my mind right. Because sometimes too, when you studied your butt off and you hear people talking about the test and they say something that's not right, it can throw you off, and that's not their fault either. Sometimes I know for me, when I'm again nervous for a test, I know what I'm talking about, but if I'm nervous, I might say the wrong thing or mean something else but say something else, and someone's like, that's not right, and I'm like, wait a second, I know that's not right. I don't know why I said it. I didn't mean it that way. So I think sometimes other people do that too. So they'll say, oh, this is this, and you're like, wait a second, that's not what I studied. And then you'll start to second guess yourself and freak out and try to be like, oh God, I'm going to fail this test because I don't remember any of that they're talking about. So sometimes it's just good for me personally to just kind of escape from everyone and just literally walk into the testing site right before the test. Like, I'm talking about a minute before it's time to start the test. Now to the nitty gritty, to study before the test. So this is what I've been doing, and I'm probably going to stick to this until the end of nursing school, because it has worked for me, has not had any bad implications in my life, so I'm not going to change it. The first test, I got a med-surg, I got an 86. The second test, I got an 88. Our first test was on fluid and electrolytes, which is just a lot of what it sounds like, fluids, knowing different IV fluids, why you would give an IV fluid, also the different types of electrolytes, the normal ranges. Your instructor will give you what normal ranges to know, and so forth. And the second test we had was on diabetes. It was all diabetes. The grade we have to get in our program is a 75 or higher, or that's considered failing. So I was really blessed to get those grades. So I just want to tell y'all my grades, just so y'all know that I'm not just trying to give advice and I ain't even doing that great myself. So that's that. Alright, so the first thing that I do, that I usually either do notes or I do book. It kind of goes back and forth, but I definitely recommend you guys to always read through your chapters before a test. Now, this is our med-surg book. As you can see, this junk is thick and chunky. All right, so the first test we had, these are all the tabs I put for our test. So we had quite a bit of chapters. I did not read really anything during the first test, and I did good because I just really focused on the notes and did a lot of practice questions. But again, I definitely recommend reading through the information because it just helps you get a better understanding, so you're not trying to cram practice questions and the notes in your mind and then you end up missing things, because there was things on the first test that I knew were probably coming from the book because it wasn't in our notes. So it's just safe to go this route. So I'm going to show you guys what I mean by reading your book, because I'm not saying read word for word because that's dead. It's too much stuff in here. So this is our chapter on diabetes, and as you can see on the first page, I did not highlight everything. I go through, what I like to do is I go through my notes, and there, I'll say the first pair of notes we learned about just the basics of diabetes, like glucagon, glucagon, however you say it, why your body doesn't produce insulin, why someone has type 1 diabetes, why someone has type 2 diabetes, all that just basic stuff. So when I go through my notes, I like to just look and say, okay, what did we go over in class note wise? Hope you guys can see it. And as you can see, I'm not highlighting every freaking word. I'm not going to read every word. I'm just going to read what we went over in class, what the teacher touched on that may have not been in notes, but she said it, like she was like, oh yeah, y'all should know this. And any bolded words, anything that just looks important. In this book, you'll see that they have some items that are italicized. They'll have little boxes as well that are like a different color than everything else to show you that it's important. Highlight all of those. Any type of side note box, I'm trying to find one for you guys. Any type of side note box, any type of box that has different different ranges, highlight those. Like we had to know what a fasting glucose test, what a normal range would be, what an abnormal range would be, and I highlighted all of that. Any type of box telling you how to treat a patient, definitely look at that. And here is what I mean by important boxes. So as you guys can see right here, it's like a yellow box. I highlighted a blue, but it says drug alerts. Anytime you see any box that's a different color, that has big rated bold words, italicized, saying, hey, you need to know this, highlight that, because a lot of instructors like to kind of touch on that or quiz on that, because it's something that you should know as a nurse to be kind of on high alert for. So definitely study all that. And that's really it. Any type of table, say your instructor was like, no table 34-2. Highlight that table, rewrite that table out, do whatever you have to do, because anytime your instructor says side note, know this table, know this page, know all this, it's going to be on your test. And some instructors like to ask a lot of questions straight from a table. That's just the truth, because tables again mean important stuff. Does that mean you need to know every table? No. If you see a table and it don't really got nothing to do with nothing, or it doesn't really go with anything your instructor said, I would just ignore it. Or if it's something that you kind of already know, like if it's a table talking about how to inject insulin or how to give an insulin shot, you probably don't need to read that, because we learned that in fundamentals, so that's not really something important for right now. So just highlight again all the important stuff, everything that you went over in class as well, italicized stuff and bolded words, and that will cut your studying time and reading time down tremendously. It would probably take me all day to read this book, but with the highlighted stuff it takes me about an hour and some change. Like you can see on this page, I barely highlighted on these 2 pages, so you don't need to highlight everything, just what's important. And what I like to do is I like to just read that stuff about 1 or 2, maybe 3 times. When you read the book and you have your notes, you will more than likely not miss pretty much anything. If you miss something, it's going to be really tiny, but it's going to be pretty much, when you take the test, you're going to be like, I saw everything in that test that I read in my book. When you do this route again, and when you start highlighting your book, you'll start to see what's important, what's not important, what you should look at, what you shouldn't look at. It'll start to just kind of come to you. But definitely make sure that you go through the book, you highlight important stuff, you highlight what's in your notes, you highlight anything italicized, bolded, different color boxes, any boxes that your instructor said, any side notes that your instructor said, because you will see all of that again. Next is notes. I'm just not going to show the notes because I don't think we're supposed to. I don't know if we're supposed to or not, but it's just notes. Our instructors, we don't get PowerPoints. We just get outlines of our notes. And our instructors already told us that if it ain't, if we don't talk about it or in your notes, don't worry about it. So that's a blessing too. But I like to highlight my notes really good. And I like to go through my notes a lot, as well as my book. I like to keep my notes on me when I go out. If I'm going, say if I'm going to my boyfriend's house, or we're going out to eat, or I'm going to the dentist or the doctor, or I'm just sitting around, I like to keep my notes in my bag, because if you're not doing anything, you can pull out a PowerPoint note or outline and look at it real quick, because usually you can go through some notes in about 15-20 minutes, honestly. So I like to keep them on me because you can take them with you a lot. And I like to read my notes, study my notes maybe once or twice, probably at the beginning when we start a lecture. Like say we're learning new content and our test is in 3 weeks. I like to start literally at least looking at it for maybe 5 to 10, maybe 15 minutes, as much as I can. Maybe not every day, but at least a couple times a week, and then up it before the test, because that way the information is getting further in your mind. So you can rotate. Say there's some days that I look at my notes and I don't look at my book. There's other days that I just look at my book and I don't look at my notes. You want to just rotate out how you're studying, because you want to get the information again as much as in your mind, but you don't want to overstudy and you don't want to do too much and your brain is like, what? So I really prefer to get the information from the book first. So read the book a couple times, like the chapter, and then kind of start looking at the notes, because everything will kind of come together better that way for me. Now, if you want to do it differently, do notes and then look at the book, it's totally up to you. But I definitely recommend, as soon as you start going over content, and probably 3 weeks before the test, start again looking at your book, looking at your notes, rotating it out, and trying to study at least 3 or 4 times a week for at least maybe 30-40 minutes to an hour each day, and then upping it when the test is about 2 weeks away. This way you can get the information in your mind, you'll get the information stuck in your mind, so that that week before a test or that weekend before a test, you're not trying to learn content, you're just reviewing. You're like, all right, I've been reading my book, I've been studying my my notes, I got this information in my head, now I'm about to just do other stuff to kind of just embed it further and just to kind of refresh it, versus it's 2 days for a test and you still don't know what type 1 diabetes does, or what this what glucagon does, and you know, or what the normal range of potassium is. You already know it. Now you're just doing practice questions to kind of get an idea of how to answer questions for the test. Alright, so next is the next step of my studying. So after you feel like, alright, I got about 85% of this information in my mind, I know the book pretty much inside out, I know my notes pretty much inside out, now I'm going to get into, it's getting closer to the test, probably a week before the test, and I just want to further get this information in my head. What I like to do is I like to do practice questions. With this MedSurg book that I showed you guys, it's an app called Evolve. You have to pay for it. Luckily, I had a classmate who was luckily to give me her login because I was like, that's a little pricey and I was kind of broke. So she let me use hers and I was able to do a whole bunch of questions on there. I also did the questions that just come free with the book. You can just definitely, you can make a login and it's a code in your book. You can add the code to the Evolve site and you can get free practice questions on there. So I definitely recommend anytime you get a brand new textbook to sign your textbook up online, because they give you free questions with this book. I also have my NCLEX examination book, which I also signed this book up online as well. It has a ton of questions and it also has questions in the book for whatever I'm going through. So I would just literally look in this book and look for diabetes, and it has a ton of questions. I think it had like probably 15 or 20 in the book and more online. So I would do a ton of practice questions, and whatever questions that I kept missing, say I kept missing questions on peak times. I know, alright, side note, you probably need to study peak times. Also, I kept missing questions on the drugs, especially the you have to know the, not the brand name, but you have to know the generic name now for the NCLEX. And I suck at generic names, and I kept missing them suckers. So I was like, you need to learn the generic names. So practice questions help, and this is why it's important to get the information in your mind before a week leading up to the test, because you can just focus on just a couple of certain things and that's it, and then review all of it at the end right before the test, instead of trying to again remember everything and learn everything at one time. This is why that's important to start studying right when you learn content, or a little bit right after, so that it's already embedded in your mind, versus you trying to cram a week to 5 days before a test. It's not going to work. It's not going to come out good for you. I'm just telling y'all now. So do those practice questions, because those questions will really help you see what you're struggling in. So I like to put stars or just some type of side note for anything that I struggle with. So say you studied and you're like, all right, I'm having problems, like for example, diabetes. I'm having issues with the drugs. I'm having issues with the peaks. I need to really focus on that. So then what I would like to do is go back in the book and write down anything that I keep forgetting. Missing the peak time for regular insulin. I would literally go in the book and I would get my handy dandy note cards. Y'all know I love note cards. Note cards save lives, y'all. Save lives. I would get a pack of note cards and I would write, say I can't remember the peak time for regular insulin. So I'll write, okay, regular insulin. Say I can't remember what a normal range for potassium is. I'll write it in here. Say I can't remember what interventions I would do for somebody who is experiencing hypoglycemia. I would write in note cards. Say I'm reading, you know, I went through practice questions and I kind of reviewed through my notes and book, and I can't remember what IV fluids to give someone who is experiencing having high potassium. Write that in note cards. Your note cards should only be what you cannot remember. After you do those practice questions and you like, all right, let me go review my book real quick and see what else I don't remember. Let me just go through my notes real quick and see what else I'm having problems with. Whatever you just cannot remember and your brain's like, what the heck is this? Only put that in note cards. Do not be that person in class who has 5,000 note cards, because you're not going to remember anything. Note cards are just supposed to be for important, I don't know what the heck it is, stuff. And you're not supposed to have a ton of note cards. When you write on a note card, it should be straight to the point. If you can't remember every single thing about diabetes, don't try to fit it all on one note card, because you're not going to remember it. Note card should be, all right, what's the normal range for, what's the peak time for insulin? And I'll literally write peak time for regular insulin, this. Next note card, what's the onset for regular insulin? This. Because when you only have, when the simpler your note card is, the better you remember stuff, and that's a fact. If that means that I have to use a whole 2 packs of note cards, that's just what it is. Because the less on the note cards, the better. Because I realized, and I had to learn, when I put too much on the note card, I ain't gonna remember none of that. But when I put literally one word, what it is, and keep it cruising, I remember the stuff so much better. Also, on the note cards, write really big and in color. That helps me a lot too. The bigger it is, the colorful it is, the more you're drawn to. That's why my note cards are always, if you guys can see, colorful. This is, I got all these from Walmart. This is just like a pastel color. And then also, this is my favorite ones too. These are just the ruled note cards too, and they are colorful. These are like, I think $2. These are like $2 and some change. But I like these because they have the rings. You don't have to have a whole bunch of separate note cards, and you can kind of just throw this in your purse, your bag, your whatever, and take it with you. There's even times that I worked at the gym and I put these in my pocket and I'm literally on the treadmill looking at my note cards. So I love getting the ring ones. Again, they are going to be $1 more, but they're worth it. But again, note cards should only be what you cannot remember. So let's refresh it. When you study, say you just, okay, you're starting your new content. You just had a test. Today you're starting your lecture on different diseases of the lungs. We're going over respiratory. So you're learning about what goes on with the respiratory system. From that day on, for the next 2-3 weeks, you should be looking at your notes, looking at your book, rotating out, rotating out. And then when you go over a new lecture, all right, now it's time to look at that chapter. Now it's time to look at those notes. Rotate out, and then add on, add on. And then by the time you get to a week before the test, that's when you start doing the practice questions. You get your book, you get your NCLEX book, you go online, you do whatever you got to do, get practice question in to see what you're struggling to remember. Once you did all that, you figured out, all right, I keep, when I do practice questions, when I'm looking at my notes, I keep forgetting these items. Make note cards of those. Only those. Don't put too much on the note card. It only should be a couple things on this note card. Don't put too much stuff on the note card. Then start reviewing the note card. Reviewing the note card. So then, once you're getting to like the weekend before a test, at this point, you should literally just be looking at like note cards and doing practice questions. And then only kind of skimming through your notes. Because at this point, you should have the information pretty much in there. Then you want to start skimming through your notes, and you want to start really focusing on the note cards, really focusing on things you can't remember, doing a lot of practice questions. Before a test, you should be pounding practice questions. I'm talking about you should be doing probably like legit, probably 100, maybe a little less than that of practice questions before your test. You really want to do practice questions because that helps you to learn how to answer questions. Because again, a lot of people struggle with nursing school because you're not going to get asked, what is type 1 diabetes? They're going to say, this patient just got diagnosed with type 1 diabetes. What would you tell this patient about her diabetes and why this is occurring? It's not going to say, oh, yeah, type 1 diabetes. Oh, that's just when, she doesn't got no insulin. No, it's going to say, why? Okay, what happened? Oh, yeah, it was type 1 diabetes. Usually it's childhood onset, and it usually happens when someone maybe just has some type of viral infection or some type of infection that goes on with their body, and now their body is attacking insulin cell because it does not recognize them. So the person no longer can make insulin. So that's why you are experiencing type 1, because something happened with your body along the way, and now your body is attacking. It's an autoimmune disorder. It's attacking its insulin cells, and that's why you can't make insulin, and that's why we have to give you a pump. Okay, so you're like, all right, okay, why do you lose weight with insulin when you don't have insulin? Okay, you lose weight because you have to know the nitty gritty, why this happens, not only what it is, but why does someone with type 1 diabetes lose weight? Why does someone, with type 1 diabetes doesn't do this or doesn't do that? Why type 2 does that? Why, when someone has hyperglycemia, do I do this? Why is hypoglycemia more important? When you're studying, ask why. Why is this happening? What would I do? The biggest thing when you're studying, we're not studying, and this is not to be like we're less than doctors, because honey, there's nurses out there who can hold their own. You would think that they were doctors the way they wrote. This is just the truth when you're in nursing school. I'm not in medical school. I am not studying to be a doctor. You are not, if you're in nursing school, you're not studying to be a doctor. You do not need to know the deep details of patho. Patho is just to give you an idea. And I'm going to tell y'all now, I have yet to see a patho, why, and what is this? I'm questioning on my test. The most I'll get is just, why does this happen? But it ain't going deep in detail. And don't do that. When you're reading your book, usually the first couple pages is like breaking stuff all the way down. And you don't need to know that. I don't need to know the deep nitty gritty of the disease. My job as a nurse is to know, nursing students to know, all right, you're sick. This is what's wrong with you. So this is what I got to do. All right, you have type 1 diabetes. All right, this is what I'm going to do. This is the symptoms I need to look for. And this is what kind of medication you're probably going to get. This is what this is supposed to do for you. All right, you came in here, you're showing signs of decay. All right, I know that. All right, when you come up in here, this is what you're going to show me. This is what I probably need to do. This is what needs to come first. This is what I need to watch for when you are on your treatment. That's what you need to know. As a nurse, we need to know interventions, signs and symptoms, medications. When you're studying, think of this. In med-surg, what I need to know, signs and symptoms, what I'm giving them, what I'm doing for them. I don't need to know the deep nitty-gritty of why your cell, his cellular level of, no, I don't need to know that. Because at the end of the day, when you're on that bed and you have decay, I'm not about to sit there and be like, oh, well, his no. When you're in the hospital and something goes wrong, you have to think quick, like, oh shoot, he has decay. He having this. So I got to get him some IV fluid. I got to hand him a bolus. I got to get that I got to get that person some insulin. Okay, so it's been an hour. All right, now what? Okay, now I got to watch his potassium because his potassium might drop, because he got too much insulin going on. So I got to watch his EKGs, because that can cause some issues. That's how you have to think. Do not get wrapped up in knowing the nitty-gritty of information, because you will become overwhelmed. And I've had heard students say that, like, you know, I was studying, you know, the nitty-gritty of stuff, and I'm like, you don't need to know that. Nursing students, we don't have to know that. We need to know what we will do as nurses, what interventions will we do. And that's really what nursing is about. The doctor ain't around, you sick, so what do I got to do to make sure that you don't die and that you can get back to living life like it's golden? What medications can I plan on giving this patient, or what medications would I expect my doctor to give to the patient, so that if the patient asks me what the heck is going on, I can tell him, okay, your doctor's, you know, he's giving you potassium because, you know, you had DKA, and, you know, we had to push some insulin in you and some fluids, and, you know, once we push it into you, you know, your cell might swell up, and then if it swells up, all the potassium is rushing your cell, and you don't got that much potassium in your blood, so we're giving you potassium supplement to kind of put that junk back into your blood so you don't fall out nowhere. Like, you want to be able to break stuff down, and that's why it's good for nurses to know medications, and again, signs and symptoms and interventions, because we're supposed to be the ones who are teaching patients and telling patients what's going on, because usually when stuff is going on, the nurse is the one to stop and, you know, the sad or scared mom or that scared wife or that scared husband's like, what's going on? You have to stop and say, this is what's popping, and this is what's going on, and this is what I'm doing now. You're not going to sit there and say, well, his cell. You're going to sit there and say, he's sick because of this, and that's why he's doing the shivering, the shaking, da 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 da. So we're going to give him some insulin, and we're going to give him some of this, because we're going to try to get this up, and this is what I'm doing, you know. And that's one thing to definitely remember when you're studying. Don't overstudy, don't overthink it, y'all. We are studying to be nurses. We're not studying to be brain surgeons right now. You know, if you want to do that, that's bomb. And when you get there, then you'll be like, all right, now I can really get nitty gritty. But in nursing school, you don't have to do that, because you don't want to confuse yourself. You don't want to overthink stuff, because you'll find yourself overthinking questions, or you'll find yourself studying things that you don't really need to study for this test. As you'll see with NCLEX style questions and nursing tests, that all of it is really, what as a nurse would you teach the patient? What as a nurse would you do if you see that they're, you know, showing signs and symptoms of something? And what signs and symptoms would you see in a patient with this? And, you know, and that's just that. Or who's a priority? If you have 5 patients and, you know, you have different people, who comes first? What symptom is just so bad that you like, I have to see him first? And that's really helps a lot as well. And so the last thing too is, say, you know, maybe you have a day or two before the test, you're like, all right, I feel really good, I feel really confident, but you still can't remember one thing. This last diabetes test, I could not remember peak times for nothing and meds. And I was like, oh, heck to the no, I can't believe I'm missing. And that was supposed to be like a chunk of the test. So I was like, oh, shoot. So say if you get to that day or two before a test and you just cannot remember 1 or 2 things, and you studied, you read, you done did practice questions, and you're just like, it ain't clicking. That's when you start to get into writing stuff over. And actually, one of my classmates said this. This is just the page you see. I literally kept writing stuff over and over and over and over again. One of my classmates actually said she rewrites her notes, and that's all she does for tests. And I was like, I wonder if rewriting would help me. So literally, I could not remember peak time. So I literally wrote out tables, and I would write the peak, the onset, the duration. And then I would try to rewrite it out and see if I remember it. And I kept struggling to remember the peak times for regular insulin, NPH, and long acting. So literally, like on this page, I have regular insulin, and I wrote it out. And then I have long acting, and I kept writing long acting, onset, peak, duration, long acting, aspart, lispro. I kept writing them over and over again, and this helped me so much, y'all. The day of the test, I literally knew this stuff like the back of my hand. And I really say it has to do with the fact that I rewrote my stuff so much. So if you get to that day before class and you're like, I cannot remember this, just rewrite it, and it's gonna feel like you're in the 3rd grade and you got in trouble for smacking somebody or something. But it really helps. But when you're rewriting it, don't just rewrite it. You have to sit there, and when you're doing, you're like, all right, Humalong, it's lispro. All right, onset 15 minutes, peak 30 to 90 minutes. When you're rewriting it out, say it in your mind or say it out loud. Say, all right, Novolong. Novolong is aspart. All right, onset 15-30 minutes. Writing, you're still writing while you're talking peak 1 to 3 hours. Because when you say it out loud or you say it in your mind and then you're rewriting it, it just starts to click a lot better. And before you know it, you'll start to recall stuff a lot better. And this is also why when you're taking your test, if your instructors give you that piece of paper, write on that piece of paper. If you know that you sometimes can forget stuff, write stuff out. Because that has saved me on test questions. Sometimes I'm like, what drug is this? I don't even remember. And I literally write down, okay, well, like it was a question, I think it was about Lantus. And I could not remember the generic of Lantus. So I literally wrote it out. And I sat there and I wrote the peak stuff. And I was like, oh, I know what this is. And it helped me remember. Because I was like, oh, your brain's like, oh yeah, girl, remember you was writing that 50,000 times yesterday? And it's this. And you'll see that it'll just start to flow out when you start to write it. So it's definitely important to definitely rewrite stuff and say it over and over and over again when you can't remember. And it really will help. Some people even get, I seen dry erase boards. I just use pieces of paper. But some people get dry erase boards and they'll rewrite stuff over and over and over again. Whatever works for you, do it. And that's really all I have been doing. And that has been working out for me very, very well. Again, everyone's different, everyone learns different, so if you have to do certain things, but one thing you will learn when you get into med-surg and when you get into psych is that there's not just one way to study. You're not just going to study your notes, you're not just going to study a book. Sometimes you're just going to have to incorporate everything that you can, and that's just how it is. And you just have to do whatever you have to do to graduate and to pass that NCLEX. Put in the work. Do not slack off. Do not study. Do not put off studying. You have to work. Yes, you will not have a life. Yes, there's going to be times where you feel like you're annoying because you're out with your boyfriend or your girlfriend and you got your notes and your note cards in your hand and you sitting there going through note cards, or when you're at family functions and you're like, I got to leave early because I got to study. It's going to happen. But at the end of the day, you have to look at it like, it's gonna feel so good. You know, y'all, like when I get good grades on tests, it feels so good because it's like I did all that work, I put all of that energy in there, and look at my results. Like, look at this, and it's gonna feel so good. And this is what you have to think of to yourself too. When you graduate, it's gonna feel so freaking good when you walk down that stage or whatever, however it's gonna be set up. You walk down that stage, you get your degree, you got your family there, your people there, and you can say, I did this, I'm now a nurse. And you can start working, and it's going to feel so good to be able to work, to do what you love to do, to be able to live that life. Because I'm pretty sure a lot of us who are nursing students, we're broke. We ain't maybe not living by ourselves, or we are, but we're struggling. Like, we want to get our life together, we want to move out, we want to get married, we want to do so much things. And just think about like that moment when you can say, I did it, I could do what I want to do now, I could get my life together, I can be in the career I want to be, and I don't have to be working at no dang here making this much money. I don't gotta be doing this, I don't gotta be struggling, I don't have to sit here and be eating dang McDonald's all the time and getting fat because I'm just a bum. Like, it's gonna feel so good, y'all. And just think of that. When you're sitting there and you don't have no urge to study, just think about that. Think about when you applied to nursing school and you were crying your eyes out when you got accepted. You were so happy. Don't slack. Don't slack. Don't stop studying. Don't have it. You got to put the work in, because prayer without work is nothing. Do not get into nursing school, and especially do not get into second semester and be slacking. This is the time to work. Work hard, pray harder, keep fighting, keep praying, y'all, and y'all will do great. Y'all will be nurses. We all gonna be up in here, turn up when we graduate. So I hope this video helped you guys, and thank you guys so much for watching. Stay tuned for part 2 with psych, and as always, thank you guys.